All right, well, welcome everyone to the April Member Spotlight. Today we have with us Dr. Claire Fellman. Dr. Claire Fellman is an associate professor in the Small Animal Internal Medicine Service at Tufts University, Massachusetts, and the president-elect of the International Society for Companion Animal Infectious Diseases, or ISCAID. Claire earned her bachelor's degree in biological engineering prior to her veterinary training at Mississippi State University. She then completed residencies in small animal, internal medicine, and clinical pharmacology, also at Mississippi State University, while doing a PhD investigating the effects of I'm going to say that wrong, and you might need to correct me, Claire.
Cyclosporin, yeah.
Thank you. On immune function in dogs. Following her residency, Claire began her work at Tufts, where she leads a One Health collaboration with physicians and pharmacists from Tufts Medical Center, with the goal to bring successful antimicrobial stewardship strategies from human medicine to companion animal veterinary settings. Claire's clinical interests include infectious and immune-mediated diseases. So welcome, Claire. Today she's going to talk about ISCAID and supporting infectious disease research and antimicrobial stewardship globally. If you'll advance the slide, we'll do just a few housekeeping items before Claire starts the presentation.
Oops.
Just a few reminders, your audio line is muted. Questions will be taken at the end of the presentation. The QA option is below. Type questions in the question and answer area. We will be recording this webinar and it will be posted on Exchange later this week. And slides are not available for this webinar. And thank you for joining us. So if you could advance to the next slide. We already kind of went over this, but again, just a nice introduction to Dr. Claire Fellman. And if you want to go ahead and get started, be my guest.
Great, thank you. And just because there was a question that came through on the chat, is the audio coming through okay for other people? I don't know if anybody can comment, but I can hear. Okay, seems like it's going okay, but we will have the recording in case anybody's having some issues. Getting lots of yeses, very good, excellent, and thank you for joining so we can talk about ISCAID. And I guess we'll pause the yeses, and I think this is probably familiar to many folks, but how many folks are aware of the ISCAID antimicrobial use guidelines? Maybe you can write aware. Okay, so we're seeing some yay, yes for guidelines, excellent. So I think that's definitely what people are most familiar about regarding ISCAID, and that's definitely one of the things as an organization that we're really proud of. But I'm pleased to have the chance to talk to you guys today about ISCAID, and I'll admit it's a group that I started out as well being familiar with because of the guidelines and knowing what they had done, or knowing the impact that they've made within companion animal veterinary medicine. And I wanted to learn more about the group, and so I had offered to step into leadership of ISCAID, and then ended up as president-elect, as you sometimes do when you express interest in a society. But I've been really, I think it's a really great group, and it has a lot of potential, and we have a lot of really committed members with some really outstanding expertise. And so my hope in this talk is to be able to share a little bit more about what the organization is up to. If you haven't joined, to talk a little bit about membership and what we hope to gain through that, and also talk about our upcoming meeting that we're having in October in Vancouver. So just to give some of the background of ISCAID, so it is a group focused on, as the title says, the International Society for Companion Animal Infectious Diseases. It was started in 2006. It was the brainchild of Jane Sykes. And I put some of the things just pulled off the website here regarding why why did this society come about? What was the gap? What was the need? And really what we were recognizing is that people are more and more interested in this idea of companion animal infectious diseases, whether that be as a sentinel for certain infections, for example, fungal infections in different regions, whether that's because we're interested in the potential sharing of resistant bacterial infections between animals and people and the other zoonotic aspects. And so really this is a growing focus that didn't really have a space. And so we needed someone to take this up, to champion this effort. And so Jane said, we really need a group like this. And it was turned into a 401c, a nonprofit organization. And as it shows here, there's an increasing need for formal recommendations for the diagnosis, prevention, and treatment of companion animal infectious diseases. And so not only is there increasing interest, but especially when these guidelines first started coming out, if you think about 2011, at the time, there really weren't very many people providing evidence-based recommendations on how we should be using antibiotics in dogs and cats. And so that was really the perceived need that got everything started. And then there's also all the potential benefits, as it shows here, for collaboration between scientists within human and veterinary medicine. So very much within the One Health space, very much a goal and drive of this group. And so the missions of the society, so to increase the knowledge of companion animal infectious diseases through encouragement of basic and applied research. And so research is something that we are still working and trying to get more support to, for example, consistently offer a research program. We are trying to enhance the professional development of workers. We're trying to exchange expertise. Frequently, expertise might be siloed, and perhaps you have a microbiologist, but you don't have someone that really does a lot of work clinically. And so we want to try to foster and make these connections between different groups. We want to support the dissemination of information. We want to support veterinary training within this space and start to think about policy. And I think that's a really exciting and interesting place. And as we entertain, being involved and being a part of NIAMRI, how can we shape this? How can we provide our expertise, support some of these questions? Because we do have a really diverse group of stakeholders. And so currently, there are a lot of people that have been members, but our current totals are about 200 people from over 20 countries. So I thought that was really exciting. And so we do have a global scope. We have a lot of members within the US, within Canada, within Europe, also a lot within Australia, and then a few scattered. We have some Japanese, some Chinese folks. And so there is a really nice representation of people through this organization. And just to speak about the guidelines first, because I think the guidelines are a really critical piece of what the group has done. And I think that this was a challenging time to be making guidelines because human medicine will complain about not having enough research to be able to develop appropriate guidelines. And they have a bounty of studies compared to veterinary medicine, and yet they still struggle to make precise recommendations. And here we are on the veterinary side saying we've got a couple studies looking at these drugs, but not a homogeneous disease population. And so ISCAID said, we're going to do our best. We're going to come up with some recommendations, and we're really going to identify where is the current knowledge, where is the target that we're going to try to get to, and what can we say about the current state of use and where it should go. And I think one of the things that they did really nicely within the guidelines is coming up with recommendations for areas for research, trying to make recommendations for funding to be able to answer these questions, even for things like uncomplicated urinary tract infections, which we call sporadic bacterial cystitis. Those things are things that through the efforts of ISCAID, it has prompted additional research. There's ongoing studies that are trying to answer the questions that have come up through the process of making antimicrobial use guidelines for dogs and cats. And so what ISCAID did is they pulled together experts, and so people that have microbiology knowledge, so knowledge of the organisms involved. There was a thorough lit search to look and see what do we know about human medicine. And then we're going to have the clinicians and the pharmacologists that are going to help guide recommendations surrounding what are the best drugs, what are considering both penetration into various tissues, considering stewardship, considering durations of use, and really what they were able to accomplish within these guidelines was expert consensus. And as I've already alluded to, there's not nearly the amount of literature that we'd love to have to draw on to create this, but we're becoming increasingly systematic as more publications are made, and we know that guidelines are an iterative process. And so we started within a few different domains that we'll talk about. So urinary guidelines came first, and then we have skin and respiratory guidelines as well. And so starting within these areas, and now as we start to see the research coming about, we're updating the guidelines accordingly. And so this was the first guideline that came out. So this was 2011. So the antimicrobial use guidelines for treatment of urinary tract disease in dogs and cats. And it was a compilation of the working group of ISCAID. And so you can see some of the authors, they're very, it's a very eminent list of folks. So Scott Weiss has led a lot of the efforts within the guidelines. I won't read all the names to you, but we have some pharmacologists, we've got internists, we've got a lot of microbiology folks, and so just a lot of different expertise throughout here to try to take into account and summarize for people what are the pathogens that we need to be knowing about, what do we need to consider again in terms of drug dose and duration. And so this was updated. So this was the first guideline to be updated. And so I wanted to look at some of the contents. And when we talk about veterinary guidelines, I'm not going to go through the guidelines blow by blow in terms of every single section and the recommendations, because that's the subject of multi-hour lectures. And I think that's not exactly what we're trying to do within the scope of this talk, where we're just talking about the organization. But I do think it's important to recognize what is the scope that they were trying to achieve and how much mileage they are covering within these urinary guidelines. And so within this updated urinary guideline, so this shows these are the different focuses that it has. And so it starts with what they called sporadic bacterial cystitis, so sort of your simple, no complicating factors for bacterial infection. And then it goes through recurrent cystitis. It talks about things, is it refractory, is it relapsing, is it persistent cystitis? And so trying to come up with some definitions, some recommendations for treatment. Also talks about upper urinary tract infections, so pyelonephritis, talks about prostatic involvement. And I think one of the things that was particularly important that for me as an internist has been a game changer and a paradigm shift is really promoting this idea of subclinical bacteriuria. And so that was present in the first guideline. It was reiterated and some aspects of the recommendations changed within this guideline, but really very impactful to highlight for veterinarians that not all bacteria in the urine needs to be treated, which when I was in vet school, over a decade ago, if there was bacteria there, the goal was to get rid of bacteria. And now we know that really we're only treating bacteria when it's clinical. So when we have signs associated with it, and ISCAID was on the front side of making that recommendation. And now they're being even more explicit with different scenarios where we need to be mindful and how do we interpret pyuria in the context of a lack of clinical signs. And so, so I think this is a particularly important piece, but they also have other recommendations. And so there's recommendations about urinary catheters. So when should you culture the urine? How should we deal with the presence of bacteriuria? Again, that's subclinical associated with the catheter. They give recommendations about different urologic surgeries and even include things about when we're dissolving struvite stones, which in dogs are associated with bacterial urinary tract infections, what recommendations should be made there regarding our antimicrobial therapy. And so, if you think about what the human side might do with this is a bunch of different guidelines. And in truth, we're actually working on updating these urinary guidelines and breaking out these different pieces for a couple different reasons. One, so they can be as complete as they need to be within the given sections, but also to help be able to keep them up to date. And so if one section changes faster than the others, we can update that as needed. But this is the process that ISCAID has gone through, is to do a critical assessment within the literature, to evaluate it. We're going to perform meta-analyses. We're going to do some grading of the evidence and really see what we can find to dig down onto these questions, tackling a broad range of issues under each of these umbrellas. So it's not just lower urinary tract infections. As you can see, it's a very comprehensive list of recommendations. And I think one of the things that I've heard Jane talk about is she didn't anticipate how much feedback she would get, regarding, I don't agree with X, Y, or Z. And of course, this is expert consensus, but in many cases, it's not always, or it's not driven by veterinary evidence. We extrapolate some things from human medicine and try to make the best recommendations that we can. But I think it has done a tremendous job to, as I was talking about, raise awareness of subclinical bacteriuria, raise awareness of the fact that we don't have duration of treatment studies for things like uncomplicated cystitis. And so I think that it's done a lot to drive research and also drive people to be interested in these questions and how do we get the recommendations and how do we get the evidence base that we feel comfortable with making updated guidelines. And so we have, as I was mentioning, different guidelines. So that's kind of the urinary guideline in a nutshell. And then we have a superficial bacterial folliculitis guideline. So we know that antibiotics for skin disease is the top reason for antimicrobial prescribing in dogs and in companion animals. And so this is looking specifically at superficial bacterial folliculitis, which is the most common form of pyoderma in dogs. And this guideline has also been updated. So this is another one that is undergoing revisions. And similarly to the urinary guideline, I think one of the important things that this raised awareness of in the shift in practice has been, instead of just giving dogs antibiotics, now we're starting to shampoo them and do topical management much more extensively. And so again, these have been things that are discussed in the guidelines, then people talk about it, people raise the evidence behind it, and these guidelines have literally changed how veterinarians are practicing. And I asked these questions at some CE meetings because even before I became involved with ISCAID, I love to raise awareness of the guidelines, and more people are hearing about these, more and more people are referencing them within their daily practice. And I hear that durations of treatment for urinary tract infections are coming down. More and more people are doing shampoo as a first line, which when I went to vet school, it was a nice thing, but it was not a critical recommendation. And so I think those are things, as we reflect as an organization on what we've accomplished, we're really pleased. And that's why we continue to make guidelines a big focus of what the organization is doing. The respiratory guideline is similarly broad to the urinary guideline. And so the respiratory guideline covers everything from rhinitis to pyothorax, if that gives you any idea. So we're going to discuss bacterial and viral involvement, both within canine and feline rhinitis. It talks about community-acquired respiratory disease in dogs. It talks about aspiration pneumonia, and it talks about pyothorax. And so it's a very expansive guideline. And again, one of the things that it does is it comes up with best recommendations and highlights areas for future research. And so these have been the principal areas that ISCAID has been working and really started, I think, astutely with the places where the most antibiotics are used and what are our top places. So it's going to be skin, urinary, and respiratory. And so really drilling down on that. And so again, one of our priorities as an organization is making sure that these guidelines remain current. You can see that this came out in 2017. And so we are looking to update this and start to think about this as well as we're simultaneously updating the urinary guideline. And just in terms of the process for creating these panels, it is initiated by people that have an interest, but then we try to very deliberately make sure that the committee is balanced with people that represent all the stakeholders and the folks that we want to be engaged in these discussions. And so I think another of the things that we have tried to do is make this information accessible. And so the publications I just showed you are available through open access. And not only did we want to have those guidelines, but we wanted to pull together some of the resources that people could use within the domains of infection control. And so you can see that we have guidelines for antimicrobial. So our guidelines would fall into the antimicrobial guidelines tab. And then we've got bacterial recommendations, viral, parasites, protozoa, fungal, zoonotic infections. And so these are not all specifically ISCAID guidances, but again, trying to gather for people what are the resources that are out there. And so we really want the website to be a place that people can come, can access information about ISCAID, and when they have a question about bacterial infection or whatever the type of infectious disease is, be able to quickly gather those resources. The other thing that's a big focus of ISCAID is our biennial symposium. And so this is something that started not long after the organization was founded, but it was quickly recognized that we really need to get people in the same room. And we want to encourage this dialogue. We want to encourage this discourse. And we also want to have a place to have a focused research conversation and to present some of this cutting edge work within these various infectious disease fields. And so you can see that the first, they've sort of alternated between continents. And so we have some sessions in Europe, and then we've had several in North America, and have met biennially with the exception, or in person, with the exception of 2020, when we had to do a virtual year for COVID, which I think many groups had to. And so these seminars, it started out a little bit shorter, but lately they've been 2.5-day seminars. And again, it's a combination of features regarding infectious disease research, as well as lately we've had a clinician's day, and we'll look at more at what the symposium looks like this year, where we're going to engage practitioners and talks and relevant material. What's the latest in FIP? Things that people are really interested within in the space of infectious disease. And another thing that we really prioritize is we're trying to reach out to different audiences. And so we want to engage both general practitioners with things like our clinicians day, as well as specialists. And so many of our members are specialists. And so we do participate at both the ACBIM Forum and the ECBIM Congress, the Companion Animal Congress. And so we have a stream within that. And so we have different invited speakers. And so again, a place where people can have infectious disease research, where they can go for continuing education and hear about the latest and greatest. So this is just a picture from the Glasgow meeting. So 2022, this group was still a little bit smaller because of COVID lingering, but really a great group of folks. And there were some research presentations and awards. And so it's we really appreciate the sponsorship from different groups and from industry to be able to hold this meeting and to have this conversation and this opportunity for networking. And so speaking of upcoming meetings, our next meeting is coming up in Vancouver. So this is going to be in October. And so there's the QR code. So feel free to screenshot this or you can search it on our website. There's a whole page about the ISCAID Symposium. And so just looking at some of the topics that are on the list, so we can see here FIP treatment updates. We're also going to talk a little bit about the revised ISCAID guidelines, which are upcoming regarding the plans for the urinary guidelines. And then we're going to talk about, with this idea of the Clinicians Day program, what are the things that people want to hear about? So treating acute canine diarrhea, considering FMT, dogs with oozing skin nodules. So we're going to have race approval for this. And so it's a great CE opportunity, really encourage people to consider attending. And the thing that I am most excited about regarding this meeting is my personal bent is antimicrobial stewardship. And so I'm really interested in being involved with ISCAID, not only because I do like treating infectious diseases, but how can we grow antimicrobial stewardship and what's the space where we can really organize efforts within companion animals? Because I feel like there's been a lot of attention on food animals for understandable reasons and bacteria getting into the food supply, and that is a heavy area of use, but we're increasingly documenting the spread of resistant bacteria between pets and owners, and we need someone to take. And the ABMA, don't get me wrong, the ABMA has produced documents, and I think there are many groups that are helping lead within stewardship, but ISCAID is also now creating a space for that. So ISCAID is going to have is going to have a stewardship day where we're going to have some talks focused on small animal stewardship. We're going to have some research abstracts within stewardship, and we're also going to have a panel where we're going to talk about companion animal stewardship and what are next steps. How do we bridge efforts like what's happening with ENAVAT, which is a European network focusing on veterinary antimicrobial use, and how do we continue to grow the interest and momentum in companion animal antibiotic research and stewardship. And so just in case we have any sponsors online, I just wanted to mention that we do have opportunities still to participate and contribute to sponsoring the symposium. We do anticipate and plan for approximately 300 attendees, and we've got some different sponsorship levels. Please do contact Jane. I've got her email address listed there if you're interested in that opportunity. And new this year, we're going to have some exhibitor booth space. And so that's a new thing as the conference continues to grow. And so just talking about ISCAID and where we are and how you might become involved, you're like, wow, that sounds great. I want to do it. Please join us. And I think we definitely would love to have veterinarians join, but I think there's others, researchers, even physicians. If you would like to contribute to the space and the development of guidelines, we'd love to have whoever would like to join be involved in our discussions. And so membership is very reasonable. So $80 for 2 years, and we do have a trainee membership option available. And some of the things that we offer to our members and that we'd like to see increasing engagement with is posting case discussions on our member forums. So there's a space where we do have people asking questions about cases, interpreting cultures, trying to figure out what to do for some of those oddball cases. We also have opportunities for research and networking within the website. You can attend our symposium. We'd love to see more people there. If you're interested in the topics, we're still working on finalizing the program, but that will be posted soon. If you're interested in helping organize the meeting or being involved with the guideline, if there's a topic that you feel like, gosh, we just really need to do X, we'd love to hear about that and think about whether that's something that would be feasible through our organization. And I think one of the things, again, that we're looking to in the future is how can we grow clinical research and what tools can we provide to different groups? What support can we have such that ISCAID can be not only featuring preeminent research, but facilitating that getting people together, and then also maybe also offering some research support. And I think one of the things as I was preparing for this meeting and talking about ISCAID is looking at what I know of NIAMRI, I think it's really important to recognize that we have these shared missions. And so we have shared efforts in research. We're both trying to work within this interprofessional space, trying to build these dialogues and these conversations and collaboration. We're both working on education and also trying to advocate for this as a need. And so I think something that I would love to speak to anybody that would like to chat about it within NIAMRI, or I think as more organizations get involved, how can our members engage with NIAMRI? What can we do? What sorts of resources can ISCAID members bring to NIAMRI in terms of collaboration? And I think we're very good. We have sent the NIAMRI meeting out to our members so people are aware of it, but we'd love to try to build this and make this even more fruitful partnership, because I think that there are a lot of, we're very proud of our membership, and I think we've got a lot of great people. And I think that especially as NIAMRI continues to work within the companion animal space, we'd be happy to leverage some of that. And with that, I see that there's a few questions that have come in, but I really appreciate having the opportunity to speak about ISCAID and some of the things that we're up to. And I appreciate the other members of the board that helped me in preparing this talk. And Crystal Reagan is the current president. Jane's still involved, Jonathan Deere at Davis. And then we have some other members. And so thank you. And let me start looking at the questions.
So I see.
Oh,
sorry, let's go ahead and give them a minute just to get some more questions in. If you want to advance to the next slide, we'll talk about the NIAMRI question or conference while we get those questions rolling in a little bit more. So as you said, how can ISCAD members get more involved with NIAMRI? Our annual conference is a great opportunity to do that. So in May 14th through 16th, we'll be in Columbus, Ohio at the Blackwell Inn and Fall Conference Center. We'll be hosted by The Ohio State University. And so if you'd like to join us, again, we have that QR code that you can take a look at our registration page. We've got sessions for bridging the gaps in international efforts and AMR, breakthrough discoveries, interprofessional practice and behavior change. We also have Dr. Scott Weiss as our keynote session on the first day, as well as Rosie Bush, Dr. Rosie Bush, on the second day. And so we've got some really exciting panel discussions and sessions, as well as some interactive opportunities as well. Our pre-conference workshop will be focusing on unleashing the power of the collaborative power of team science. So really grasping on how you can engage in that to collaborate in research efforts across interdisciplinary sectors. And then we'll have a breakout session in the conference that will break out into education and then also into research. And so we hope we can catalyze a couple research teams out of that breakout session and then send some of our attendees back with resource maps for education that they can use to increase awareness of AMR in their own organizations going forward. So go ahead and register for that. We'd be happy to see you. Early bird registration ends April 15th. But let's go ahead and see what questions we have. So our first question, Claire, it can be difficult to find funding for AMR at the intersections of One Health sectors in the US. Is that the case in other countries where ISCAD members are located?
That's a great question. And first off, I will admit, I haven't spoken to the entire membership about some of these challenges, but I think just in some conversations from what I've heard within the European audience, I think everybody has this same struggle. ENAVAT, which is I'm going to butcher their acronym, European Network for Optimization of Veterinary Antimicrobial Therapy, something like that. I know they were able to find some short-term funding, but I know that even that very successful organization is now thinking about how to move forward. And I think that's not for research. I think the research funding is something that everybody is struggling with and trying to advocate. And we really appreciate the help of groups like the presidential PACARB, the Presidential Advisory Group, suggesting that companion animals be at the table in updating these or be at the table in improving stewardship and improving education. I think that's a good tool to highlight the need for companion animal work. But ISCAID has been, we are still advocating, but I don't think we've been tremendously. I think there is movement. I wouldn't say we've been unsuccessful, but I think it's slow progress in terms of the availability of grants. But I can say that there is appetite for funding research. So Morris Animal Foundation has actually supported a project that I have where I'm looking at the duration of treatment for sporadic bacterial cystitis in dogs and comparing 3 versus 7 days of amoxicillin. And that study was also well received by the Veterinary Pharmacology Research Foundation. And so I think you have to be a little creative with where you're getting, and I think that that this is still emerging as a priority, but I think it will continue to emerge, and I think that's where ISCAID wants to be positioned to support that message, and I think that's where we can all continue to campaign through whatever fronts we have, and that's publishing our work. That's publishing the fact that animals get bacteria like carbapenem resistant Enterobacterales. I think sometimes people aren't aware of those things, and we really are a critical space to be in.
Great. Now our next question, how often does ISCAID update its guidelines?
That's a great question, and I think you see some of them. So 2011 and 2019 is the first guideline that's officially been revised and been published, but the skin guideline is just about to come out. So that was 2014, I believe, to now you're about a decade later. So it does seem to be approximately a 10-year turnaround in between things. The respiratory guideline came out in 2017, and we're starting to work on getting the evidence going behind that. I think we'd like for that to be more frequent, and that's where within the urinary guideline, we are this year planning to break up. And so we have to figure out how are we going to get that published, who's willing to support all these little pieces of a urinary guideline. But the hope is that through having cystitis as its own guideline, through having pyelonephritis as its own guideline, as you get key research that's coming out, you can be more nimble in updating that. But it has certainly, we can see the history of what's been realistic. I think if you look at the authorship list, you'll see a lot of the same people, Mark Papich, Scott Weiss, Jane, and I think that's another of the challenges that we have, and something that we're trying to maintain within sustainability for the group is not trying to get so ambitious that we can't keep things at least reasonably up to date. But there have certainly been important things that have come out within the 10-year span, and that's why we're due again, even though urinary is only about 5 years old, we want to be embracing this current literature and trying to get that on a more frequent basis.
Great. And then are you seeing any upcoming tools on the horizon for helping the management of some of the focus areas you've mentioned, i.e. pet side diagnostics?
Yes, definitely. And I think that would be, I know Jane's really interested in that topic and has done a lot of work. And I'm also involved in a small project where we're trying to look at cost effectiveness of testing. And since urine cultures are so expensive, can we use any of these point of care urinalysis type tools? I think something that the literature is showing is the value of CRP for pneumonia management, where you don't always need radiographs for pneumonia. You can sometimes just do a CRP, and they're showing that seems to be a helpful gauge of response to treatment. So I think there's a lot of literature coming out in this area. I think there's a lot of information. I think we don't yet have a digest of this is the best test in this circumstance. I think there's always going to be limitations, and there's always going to be a gold standard. But I think there is definitely, it's a hot area, and there's a lot of, with the new technology that's coming around, a lot of different people that are looking to come up with the best assay or the best analysis, particularly for urinary tract infections. I know that's one that's an easy one. For skin, I think we're still relying on clinical signs, and now we are. I'm not aware of the bench-side stuff being as key for skin, because cytology is so helpful for that, and also now we're going to skin management and treating the underlying inflammatory disease. But there is certainly a lot of money, a lot of interest in this space, and a lot of products coming out.
Great. And then does ISCAID have any plans for an upcoming UN General Assembly meeting?
That is another lovely idea that I can brainstorm a bit with the board. I think we are eagerly looking to see the outcomes of that and to see some of the recommendations that are made. I don't think we will formally have a presence there per se. I think we're not quite to that level. But I think what we would hope to be and hope to be increasingly recognized is a sounding board, is a place where this expertise is gathered. But I think that's a very big meeting, clearly, with a lot of big questions. And I know places like PACCAR will be advocating, and it will be, again, interesting to see the outcomes from that. But I think we're more looking to see what are the priorities that are expressed.
Great. And then our next question is also a kudos. So thank you for this great presentation and the good work that is done with ISCAID. Do you know of an authority that is the equivalent for food animals that provides treatment, guidance, or working groups?
That is a great question. And I actually wish I knew a little bit more about this because we do say that food animals where a lot of the priority has been, but I know a lot of it is done within disciplines, porcine work, well, they work within their own farms, and then chickens have a lot of, or poultry has its own systems, but is there a group that's coming out with recommendations? I know the FDA is actively supporting research to support things like duration of therapy for different production animal species. I don't know if anybody in the chat wants to comment on a group. I mean, I know NIAMRI has some efforts just in terms of food supply and whatnot, but is anybody coming up with food animal guidelines? I think some of that, I think one of the challenges with production animals that I would say is there's the extra label limitations of so many of the different antimicrobials. And so, I think it's a little bit harder, but I do think that's a place where work needs to be done because, and I take that back, Enovet does have some large animal guidelines. So I'm pretty sure that they are working on mastitis and I think they were working on diarrhea, maybe diarrhea in pigs. So Enovet, the European group, is tackling a couple of those large animal topics, but ISCAID is sort of trying to embrace the companion animals. But it is a great point that there is more guidelines are needed everywhere, and there are some things like the World Health Organization designating critical importance of antibiotics, and I know they're working on an access, watch, and reserve system for veterinary medicine, which will provide some indication of the tiers of drugs to be helpful on a global level. But are there global guidelines for food animals that are widely endorsed? I think there's more country-specific things, but I think that is a place where we should have bigger discussions, potentially facilitated through a group like NIAMRI, of who is making guidelines to try to reduce duplicative work and try to get together expertise and so we can have a strategic approach.
Great. And then does ISCAID have working groups involved in advocacy?
That is an excellent idea as well. So thank you for that suggestion. And I think one of the things I would say about ISCAID is we're not a super old group. We've had a couple focuses and the guidelines have honestly taken a lot of time. And now what we're doing is we're looking to grow. And so this plan of having a president-elect, having a president and a bit more structure to the board is a bit new. And so I think we are looking for what are our next steps. And so as a board, things we've talked about are making a more streamlined or a more defined process for creating guidelines so we can produce them on a timely basis, thinking about, do we want our meeting to go to an annual basis? And then I think, how do we operationalize advocacy and where do we need to insert ourselves, I think is a great point and something that I will bring to our next meeting for a conversation point. But we are currently outlining the committee structure and what additional committees we think we need. And I think both the research committee as well as an advocacy committee are great places to continue to bring the mission forward.
And I think that's one place where NIAMRI really complements ISCAID as well, is because you are a member organization. We have these advocacy conversations, and NIAMRI does advocacy for AMR in general. And so if you're an organization that's looking for more of that advocacy arm from an AMR perspective, in a wider scope, we could definitely complement your membership with ISCAID with that. And then we have, you've definitely piqued somebody's interest in Florida. So someone would like to know if you have any conferences or events next fall near Gainesville or Central Florida.
I don't think that we have anything in mind right now. I know we are, we'll have another meeting in 2 years. We'll have the regular presentations, but I think that's an interesting point, that do we try to have some sort of regional focuses and get people together and get people talking? And I think we need to be, I think we have a bigger membership, but I think we haven't been as good about getting people reminded. And so I think getting the society to be more active is definitely one of our goals. And so if people have ideas for events and things that they'd like to see, we would love to hear that.
Great. And then getting people to change behavior can be challenging. Does ISCAD have members from the social sciences?
Yes, that is a great point. And the whole idea of implementation science, and we have evidence-based guidelines, but nobody listens to them. That is something that we have been talking about. I will say within the urinary guideline, we just brought this up as a discussion point, but I don't think that we have manifested that as a I don't think that's been done in an intentional way. But I think that's where me coming to talk to groups like this, we would love to have members that express that interest. And perhaps we need to have a more concerted call. And that's something that I will bring back to the guidelines management group that we are forming is, what are our thoughts? And do we put one of these people as an expert and a social science expert to try to see what we can do to engage stakeholders? That's one of the things we were talking about is needing to engage stakeholders at the various points to see what are the relevant clinical questions, try to do some survey work to figure out what should we be asking, what is a meaningful difference in response so that we know how we're shaping our guidelines so that it's useful to clinicians. Those are definitely questions that we've had. And I know that people like Scott Weiss are undergoing, and Carlina Scahill as well, are actively being trained in guidelines and taking a lot of coursework to be able to do these the best that we can. But I think guidelines, if you've seen the difference in ACVIM consensus statements or really any of the veterinary guidelines over the last decade, they're becoming much more stringent, much more what a guideline should be. And so we feel like we're the first people in this space and really came up with guidelines that were good for the time, but we want to remain the guideline. We want to be the standard of guidelines. And so I think, recruiting people that are going to help make sure that they're relevant and having that expertise is something that we need to continue to focus on, especially within the stewardship arena that I'm in. That's absolutely something we talk about on a regular basis is why did this intervention fail? And I told my last mentee that she needed to get training in implementation science so that we can have a better approach to making these things and measuring the effects and actually realizing change. So thank you for that observation. I think that's really on point.
And then our last question, do you see geographic differences with respect to access to care? Are there differences between rural and more urban practices?
And that is another fantastic question. And I think the answer to that is absolutely. So I think that is a very relevant point. And there are groups like the Stanton Foundation that are really interested in this access to care. One of the projects that I'm involved with, we've been looking at antibiotic prescription, and we actually use zip code as a proxy for, or you can look up median income based on the zip code. And we did see some associations with antibiotic use. And I think those are the types of studies that we need to do to understand prescribing, because that's one of my bugaboos about antibiotic reporting is right now, more and more people are saying, I can measure my antibiotic use. But if this hospital has 70% usage and this hospital has 30% usage, we still really don't understand why that's happening. And so I think we need to do more research to investigate what are the drivers of veterinary prescribing. Is it associated with income? Is it associated with disease processes? What are there is a nice study that's coming out in JVIM soon that I just reviewed where they were doing heat maps and they did find more third-generation cephalosporin prescribing in the South, more quinolone prescribing in this region or that region. And so where are those regional differences coming from? Is it differences in the disease process? Is it differences in the training? I think there are so many questions that need to be answered. And frequently I feel myself lacking in the expertise I wish that I had. But I think what NIAMRI has shown me is through the collaborations and through interprofessional work, that's how we really do the best job of investigating these topics. But I think that's a absolute yes, but I think it is currently a bit of a mystery and a black box in terms of understanding the magnitude of effect from any of those factors.
And we actually had a last minute question come through. So how does ISCAD plan to incorporate advancements in technology and data analysis to improve research, monitoring, and evaluation efforts?
So that's an interesting point. And I feel like I know that NIAMRI is involved in antimicrobial resistance dashboard and kind of collaborating or compiling that data. I think right now ISCAID has not been accumulating data per se. So we have more been trying to filter through studies to produce antibiotic use recommendations to try to, again, be a forum to communicate this information. But I think as we decide where ISCAID can be most influential, I think that there are certainly places. I don't know if this is a particular interest of anybody in the group now. Again, to some extent, trying to keep the guidelines going has been a big priority of where we're at. But I think that we would love to hear more about what we could do, because with the membership across different countries, I think that, again, we have many of the people that you would want to know within this space. And so what can we do to support further collaboration? What can we do to create this data? And as an example of a conversation that we're having, within COVID, they had a living patient registry where they were able to compile cases from different places. And some of the people that are on the urinary tract guidelines, so there's my UTI study, there's a study out of UK, the Stop on Sunday trial, and then there's one out of Denmark. And so can we try to pool the data from those studies, where even if our individual studies aren't completed, can we merge that data to create a living pool that we can draw conclusions from? We have to make sure that that's not going to affect the ability to publish our results subsequently. But that's the extent of our kind of merging data, trying to build on what people have used to date. But we're certainly open to these conversations. We'd love to think more about that. And I think, again, this is where now it's a great time to bring your expertise, bring your interest to ISCAID, because we're deciding what is the framework, what are the focus areas, and where do we go from here that we haven't been already.
And then this audience just can't get enough of you. We have another question. Looking into the future, where do you think the biggest changes in the guidelines might be? Duration of use or otherwise?
That is, I love these questions. They're wonderful. And they just had, so COHA, which is the CTSA One Health Alliance. So it's a bunch of vet schools that have a clinical and translational science unit. And so they held a day where we had human medical experts within stewardship and veterinary experts within stewardship talk about largely companion animal prescribing and what can we learn from a One Health approach. And that's what I'm really excited about at my hospital is we have a collaboration with Tufts Medical Center, and we have physicians and pharmacists that help weigh into some of the studies that we're devising and some of what we're working on. But I think one of the interesting points that came out of that dialogue was, from experience on the human side where they've done so much with this, it is much harder to change the trigger to prescribe. You know, it's hard to get people not to use antibiotics, but it's very easy to get people to decrease the duration. And that's where duration has been such a focus of human research, is trying to show non-inferiority. And I know one of the concerns that people will have is, well, if I decrease my antibiotic use, what about those cases that have a treatment failure? And one of the things that I found really meaningful from Shira Doran, who is the infection control and steward of Tufts Medical Center, is she said, just because some cases are going to need longer antibiotic course because you will have some failures, doesn't justify that everybody needs this extended antibiotic course. And so I do think that durations are a big focus. And I think that's where a lot of the pneumonia studies are looking at, rather than 2 weeks past radiographic resolution, which is not evidence-based at all. Can we treat based on CRP? Can we treat based on clinical signs? And the human studies are showing shorter and shorter durations are non-inferior. And I think the questions that we have are, when can we and can we not extrapolate from human medicine? And we do think that largely we probably can extrapolate a fair bit, but there are still questions. There's still some diseases like cholangiohepatitis is a good one, prostatitis. You know, how long do the treatment courses need to be? So I think treatment duration is a big one. And I think the other hot topic that we're really thinking about is antibiotic selection. And so one of the interesting points right now is within, and I'm curious, we haven't started the conversation, but within bacterial cystitis in dogs. So let's say uncomplicated cystitis, we say the current ISCAID guidelines say a 3 to 5 day treatment course of amoxicillin or TMS is your first line, and then they say Clavamox is also fine. Well, we say that in women, 3-day courses are standard. But if you look at many of the women flow charts, and Up to Date has a nice flow chart that I looked at, where it is not just women get 3 days of an antibiotic. It absolutely depends. Is it a beta-lactam, which they often recommend a longer treatment course because it doesn't have as good a tissue penetration, versus TMS is a shorter course. You know, nitrofurantoin has a different duration. And so I think we have been generalizing a bit, and I think that might impact our success with some of our regimens. So just to say, this duration, specifically for the urinary system, I think this is more important, but this duration is equivalent to this duration across drug classes, I think maybe a bit of an overgeneralization. And so I think that will be an interesting question that we weigh in. Should the recommendations be different for different drugs? And again, looking at some of these studies that are coming out, do we get any of that information that we can make different recommendations? And thinking about things like pyelonephritis, I think it'll be interesting to see the recommendations regarding follow-up cultures, duration of therapy for pyelo. Are there changes in drug recommendations, drug selection? But that offhand, those are just some thoughts. But definitely, if we can't change, if people still feel the need to prescribe, we're going to be able to reduce the burden of antibiotic use significantly through decreasing durations. And that's what they were doing going back to that meeting. And what they were showing is they had cut antibiotic prescribing by a lot, not necessarily by decreasing the prescribing rate, but by decreasing the duration of the prescriptions. The total bulk of antimicrobial use was down. So that is a key focus there.
Right. And then is ISCAID looking any information outside of small animal medicine? I specifically work in avian exotic medicine and was wondering what information we have there, considering it's already limited.
Yes, that is an excellent question. And I'm actually working on a study right now where I was like, we're including birds and bunnies, darn it, because there's not much data on them. And we're just we added a prescription indication to all our prescriptions in the small animal hospital. And so with that, we're able to see what type of infections are people treating, what body systems, what certainty of infection, is it confirmed infection, is it documented infection? But I definitely think that as we think about companion animals, avians and exotics are included within that. They're still animals that live within the house, and it is a place that has gotten orphaned just because of the variety of species. So I think that's another place where we could have a working group. If there are people that are interested, what recommendations can we come out with? Maybe it's not a full evidence-blown guideline to start, but maybe we work towards that, or we come up with some summary recommendations. I think we want to do justice to anything we do as a society. But I do think that that's something we're trying to figure out. How do we engage a bigger membership pool? And if there is interest within infectious disease and exotics, does that become a home under our organization? But it is very much so limited. I think we haven't talked about that as much, again, just because we've been focusing on the guidelines we do have. And cats also, there's a lot of focus on dogs, then cats are sometimes tucked in there, but paying attention to all the different species. And we've talked about trying to get more equine engagement and try to increase the discussion in horses. And a graduate student that I have now is interested in equine work. And can we do some of the same things on the large animal side? So I think that there is room. It hasn't been done yet, but we would love to think about that.
All right. Well, thank you, Dr. Claire Fellman. You have been such a great knowledge resource on this member spotlight. And it's clear that ISCAID is doing wonderful things for companion animals internationally and both nationally. So we thank you for your time. And if you are interested in learning more about ISCAID, please, reach out to either NIAMRI or ISCAID directly, and we can get you connected. As well as if you're an ISCAID member and you'd like to learn more about NIAMRI membership, we welcome that conversation as well. So please look for this recording on our website, and then we'll also have a blog as well. And stay tuned for more member spotlights. Thank you.
Thank you guys for all your excellent, fantastic questions.
Have a great day, everyone. Bye.